Great day, Hampton Roads. You're watching We Care, an interactive weekly discussion on healthcare in Hampton Roads. I'm your host, Quwania Jefferson. The accessibility to high quality, affordable, and comprehensive healthcare for all is more important now than ever before. And today's guest will share insights on how they are serving the healthcare needs of the region's residents. Our first guest is the CEO of Hampton Roads Community Health Center, Barbara Willis. Welcome, Mrs. Willis, and thank you for joining us.
Well, thank you for having me. I appreciate the opportunity to sit and talk with you today.
Absolutely. So let's just dive right in. Tell us a little bit about Hampton Roads Community Health Center. We know people in the community call them HRCHC, but tell us a little bit about the organization.
Hampton Roads Community Health Center was formed as an outpatient primary health care facility to provide services to the residents of Portsmouth and then expanded to all of Southampton Roads. We see all children, adults, newborns, everyone, regardless of their ability to pay. The purpose for forming Hampton Roads Community Health Center was so that we could provide high quality healthcare services in areas where it had been identified as being underserved with regards to primary care providers.
Okay. So HRCHC is a federally qualified health center, FQHC. Did I say that correctly?
It's actually federally qualified community health center. That gives us a specific designation through the public law that was passed by the federal government over 50 years ago, which allows for how we are able to service the uninsured by the federal dollars that we receive to take care of our patients.
Wow. So I know that this community health centers in general do not exist everywhere. I know for one, I'm from Arkansas and they do not exist there. So it's a beneficial for anyone living in a state or city that has a community health center because they accept patients of all ages, races, ages, and ethnicities, and regardless of their insurance status. Is that the same for your organization?
Well, that's correct. Community health centers in Virginia, actually, there are 26, maybe 27 community health centers in Virginia with over 140 clinic sites. And they are located in those areas where there is that disparity as it pertains to the delivery of care. We have health centers in the urban sector as well as rural communities throughout the Commonwealth of Virginia.
Wow. So HRCHC provides comprehensive medical, dental, and behavioral health care. Is that correct?
That is correct.
Now, what happens for an individual that comes in, let's say they don't have health insurance?
Well, then they've come to the right place. And the reason for that is that we have the ability to determine how much it's going to cost them for the services. For those folks whose income is below 200% of the federal poverty level, we offer a sliding fee discount. The sliding fee discount is based upon their household income, and they could be paying as little as $25 up to, I think it's $150 for services that could probably cost them because of lab and your examination and all of those different types of things could cost between $300 and $400. But because of the funding support that we receive, we're able to offer it at a minimum discounted rate for individuals who would qualify.
That is much needed information. And I don't know how well people are aware of that being a direct benefit to patients. But one thing that struck me about the organization is your mission statement. I know I've seen mission statements everywhere, and they're typically very lengthy and very difficult to remember. But HRCHC's mission statement is "We care so you can be healthy." And that's it. That's the beginning and the end of the mission statement.
And that is absolutely correct. Our board of directors went on a retreat probably about 2, maybe 3 years ago. And during the strategic planning at that retreat, we really wanted to get to the heart of why we existed and what was the message that we wanted to send to our community at large. And after going through all of the typical, as you indicated, lengthy mission concepts, it boiled down to, well, why do we exist? What do we want to be our focus? What is our purpose? And that's how we came up with the mission statement, or the board came up with the mission statement. We care, because you have to care about people in order to serve them in the best light so you can be healthy. Our mission is to provide quality healthcare service to anyone, regardless of their financial or social status.
That is amazing. And I know this past year or so has been very difficult nationwide and even globally, right? When we talk about COVID-19, and I start whispering because it's kind of a dirty word. You don't want to say it too loudly because it's been such a big, hot topic lately, from the accessibility to testing all the way to now where, the hot topic is accessibility to vaccinations. How has COVID-19 impacted HRCHC?
Well, like everyone else, it's impacted us in a big way. First of all, we had to think about how we're going to keep our patients safe. And so we, through staff, have been following the Center for Disease Control, CDC, guidelines. They've been following the ADA, the American Dental Association guidelines, as well as those guidelines that have come down through the governor of Virginia. And so with those, combining all of that, we devised a plan in terms of, one, how to keep the employees safe, and then two, the patients safe. And so everyone that comes through our doors fills out a form expressing what their current health status is. They have their temperature checked. We do social distancing. And monitoring so that we don't have crowd issues with regards to the waiting area, and then also making sure that we are appropriately attired in PPE, and as we're interacting with patients in the community at large.
Okay. And so with that, you mentioned PPE and all that. So having to wear those now, it has to be financially, a challenge for the organization.
It is very stressful. However, we are thankful that we have been able to partner with a number of individuals to help in assisting in providing the PPEs, and either at no cost or at a discounted cost. For example, United Way of Southampton Roads donated, I can't remember the exact number, but at least 1,000, if not more, masks so that we could hand those out to our patients, for those patients that may not have a mask. And then we have also been receiving financial support from the city of Portsmouth, through the Community Development Block Grant, where we were able to update our equipment, provide services where we brought on what we call our environmental service technicians, who are individuals that have learned how to clean and disinfect our building in a safe, sanitizing way. We also received funds that has helped us with our dental department, so that they were able to get equipment that would reduce the aerosol in the air, and also the making sure that our environment in general, the air purification was taking place. So we've done a number of things with the support of outside entities, and I would be remiss if I didn't also mention our federal government, through the CARES Act, allowed us also to be able to provide some services and to support our staff so that they could continue to work.
Well, kudos for all of those organizations that you've been able to partner with up to and throughout COVID-19. Now, one of the things I know, you guys recently launched your is it telehealth service? And that has to be huge, considering you're trying to keep your patients safe and a lot of patients, don't feel at ease about going out into different environments during the pandemic. How has that been a benefit for the organization to have that service available?
Well, the one thing that this time through this pandemic has shown us is that you have to be flexible. And so in being flexible, what we have found is that there are some of our patients who have greatly embraced telehealth. But then there are other patients who really like that one-on-one, face-to-face touch. And so we have been able to position ourselves to service both. Those that like telehealth, as well as those who want to come into the facility to receive care.
Awesome. So you guys have a kind of a 3-tier service model: in office, via telephone, or online.
Exactly.
Awesome.
Exactly.
Awesome. So accessibility to COVID-19 testing was really huge. It was a challenge here in the Hampton Roads area. And I know that HRCHC stepped up and did, COVID testing clinics at satellite sites throughout the Southampton Roads area. Was that beneficial for you guys? And what made you want to jump out there to provide that service?
One, because it was very much needed. We're still dealing with health inequity in our communities. The last ones to find out about services and the last ones to actually receive the services. And so to do our part, the testing became an important component. And we started off, we were super aggressive in that we were 5 days a week. We were at several different locations, all of that to provide. And through that, there were a number of individuals, and particularly families, that learned that they were positive with regards to the COVID-19. And so, but as time has progressed and the months have extended out more and more, we find that now we have to reduce to in terms of the testing, but we still provide that service and people are still coming to be tested.
Okay, so you're reducing the, I guess, the frequency of the testing. You're not doing away with it completely at this time?
That is correct.
Okay, and so as a result of that, are you now working on a plan for vaccination distribution, or is HRCHC participating in the COVID-19 vaccination plan?
Yes, we are. And it's through partnership with the, at this particular time, with the Portsmouth Health Department. They have been the distribution point for vaccines going out into the community. And so we were approached by them and asked if we would be willing to administer the vaccines. And of course, we said yes. And through that, we have had open clinic one night a week, Wednesday evenings, and then a half day on Saturdays, so that individuals who call, schedule an appointment, are able to come in and be vaccinated.
And do they have to be a patient with HRCHC, or would that be open to anyone as long as they're a part of the phase that we're in for the state?
As long as we have appointment slots, our patients come first. Let me be clear about that. And so we do schedule appointments with our patients, and there are individuals, however, that are not patients that we've been able to service.
Awesome. So in light of the pandemic, we find budget cuts are everywhere. They're massive at every level. And so with that, it kind of exacerbates the situation for someone like HRCHC because you are a nonprofit healthcare organization. With that in mind, if anyone viewing would like to partner or support the mission of HRCHC, how could they do so?
Well, I'm glad you asked that question. We are always looking for partners, those that can help us, because nothing is free. And when you think about it, your health is not free. There are things that you should be doing to keep yourself as healthy as possible. And so we appreciate donations. I would suggest that they go on our website, which is www.hrchc.org. And there is a button for you to be able to click and to donate directly to our health center.
Amazing. So right now we're getting ready to go to a break. But before we do, I just wanted to say congratulations on your partnership with Southeastern Virginia Health System. I've seen the commercial on Wavy Television. It's been airing multiple times a day, and I thought that it was amazing that two organizations that offer the exact same services would find the wherewithal to partner together and not be selfish in the sense of, oh no, we're going to make it a competition versus a partnership. So I just want to say congratulations, and when we come back, we'll talk a little bit more about that. Stay tuned right here to We Care.
Southeastern Virginia Health System and Hampton Roads Community Health Centers have partnered to provide primary care for you and your family.
Accepting all patients, whatever their insurance status. We're your patient-centered medical home. In office, online, or via phone, we're dedicated to safely meeting your healthcare needs.
Throughout Hampton Roads, wherever you live, work, or play, we provide high-quality, comprehensive, and affordable services.
Because we care, so you can be healthy.
Welcome back to We Care, a weekly discussion about health care in the Hampton Roads, Virginia region. So, Mrs. Willis, right before we went to commercial break, we talked about your partnership with Southeastern Virginia Health System. Tell us how that came about.
Well, thanks to my amazing marketing person, we were able to form that type of a relationship. But before that, the CEO of the Southeast Virginia Health System and I have been co-workers and peers working on a number of different committees and things like that for quite a few years. And so it was kind of easy when the opportunity came about for us to partner together.
Awesome. Well, to have like-minded organizations that have one goal is, somewhat rare. So to have two organizations that are willingly working together for the betterment of the community is a win-win for everyone. So let's talk a little bit more about HRCHC. So in my research, I saw that you guys were founded in 1995. So that's 25 years?
Well, actually going into our 26th year as of May of this year. And so, yes, we've been around for a good while.
Wow.
And we've had some amazing growth during that 25-year period. We started off with this location here in Portsmouth as our first site. It was a grocery store that was converted into our healthcare facility.
Wow.
And then as time passed, we moved to Norfolk, to our Park Place location on 35th and Granby. And then after receiving some additional grant opportunities, funding opportunities, we were able to expand into the public housing unit in Norfolk, as well as East Ocean View community off of Shore Drive. And then our most recent expansion was with the Norfolk Community Service Board, as behavioral health has come to the forefront, particularly during this COVID-19 period, where behavioral health is so important of a service to be able to offer. And so we were able to establish an integrated primary care behavioral health program on the property of the Norfolk community with the Norfolk Community Service Board.
Wow. So HRCHC, under your leadership, sounds like you guys are doing amazing work. You're meeting the needs of people from all different walks of life, behavioral health, peds, prenatal, OBGYN, men's care, chronic disease management. I mean, you're almost like a one-stop shop.
And let's not forget dental, because
Right.
that's where you have total health care, when you are able to provide that particular component as well, because the dental service is very helpful for our pregnant women, that in order for them to minimize having bacteria going into their system as they're during their pregnancy. We have a medication assistance program, which helps our individuals, particularly that have a chronic health condition, so that they can get their medications at a reduced or at no cost, depending upon the pharmaceutical company that we're able to work with. And so that they can stay on their blood pressure medicine, their cholesterol medicine, etc., at an affordable way. Because in order to be successful in your own management of care, you need to be able to have access to your medications in a timely manner. And yes, with pediatrics, our pediatrician is well known. She was a former neonatologist, and so she does excellent work, particularly with newborns at our center. And so we're very pleased to have that service available. And of course, with our adult population, we have family practice and internal medicine. So we're able to treat the full spectrum of adults from those as young as 19 all the way through our seniors. And I think when we look at our seniors, we have some patients that are like 90 years old and receiving care through our health center.
Wow. You guys are doing so much. I mean, you must have about 200, 300 employees. Sounds like you guys are doing enough to...
Well, last count, because there's so many components for the delivery of healthcare, is not just the providers and the clinical support staff, but there's a whole lot of feet behind the scene that are also working. A finance department, our quality management department, our IT department. All of those areas help to support the delivery of quality healthcare.
And it sounds like it's very much needed. So when you guys do all of this, does the federal government or an outside agency, do they do like audits or anything like that? Because a little birdie told me that you guys recently went through something they call Joint Commission.
That is correct.
Can you explain that to our viewers?
Well, the Joint Commission is like the Good Housekeeping seal of approval as it pertains to determining whether or not patients, when they come to our facility, are in a clean, safe environment for the delivery of care. The Joint Commission has been utilized by the hospital system for a number of years. And community health centers volunteered to participate in the same type of scrutiny that you receive through the hospital system. And through that, we have particularly our most recent audit. And when you're looking at what we're experiencing with this pandemic, we received extremely high marks in the area of infection control and sterilization. That means that we are doing things right to minimize the spread of inappropriate viruses and diseases within our facility.
Wow. Amazing work under your leadership. I can only imagine what you have planned for the future. So just want to say congratulations on the amazing work that you're doing to serve as that safety net provider in the Hampton Roads region. It is much needed, I believe. And so with that, how can individuals contact the organization if they want to schedule an appointment for themselves or for their families?
Well, thank you for asking that question. The amazing work that's being done is because of a lot of folks, especially the staff of Hampton Roads Community Health Center. And so our providers are open to seeing new patients. And if anyone is interested in scheduling an appointment, the number is 757-393-6363. Let me say it again. The number is 757-393-6363.
Amazing. Well, I won't bombard you with any other questions because I personally could go on asking questions just about every facet of the organization. But did you have any final words that you'd like to share with our viewers?
Our mission statement means a lot to me because through those words, it pours out what we are all about. And our desire is that people are healthy throughout this community. And so it is true. We care so you can be healthy. Thank you for having me today.
Thank you for joining us. Stay tuned. When we return, we will be talking about Big Bang Theory, internal medicine, and everything else. Stay tuned. We'll be right back.
Today is an exciting day at Hampton Roads Community Health Center because we are giving vaccine shots to first-timers and second-timers through the generous contribution or distribution to the Virginia Department of Health. So we are vaccinating for the COVID-19, and we're anticipating that we're going to see almost 300 people today that are getting these much-needed services. We are thankful to be here because this is identified as one of your underserved and targeted communities where it's very important that people get vaccinated. And so as you can see, folks do want to get vaccinated. And so we are grateful that we're able to provide this service in our community.
Southeastern Virginia Health System and Hampton Roads Community Health Centers have partnered to provide primary care for you and your family.
Accepting all patients, whatever their insurance status. We're your patient-centered medical home. In office, online, or via phone, we're dedicated to safely meeting your healthcare needs.
Throughout Hampton Roads, wherever you live, work, or play, we provide high-quality, comprehensive, and affordable services.
Because we care, so you can be healthy.
Welcome back to We Care, an interactive weekly discussion on the healthcare needs in Hampton Roads community. Now I have joining me none other than Dr. David Rosenberg. He is an internal medicine provider at Hampton Roads Community Health Center. Thank you for joining me today.
Thank you for having me.
Awesome. Well, I've had an opportunity to see you do some great work around at Hampton Roads Community Health Center. But tell us a little bit more about you and like where are you from and how long have you been practicing?
Well, I've been in practice 40 years. I did my undergraduate work at Brooklyn Polytech, my graduate work at the New Jersey Institute of Technology, both in engineering, and then I went to Downstate Medical Center for medical training, and my residency at Brookdale Hospital in Brooklyn.
So you're a Brooklynite, is that what I'm hearing? You're
For
from
the most
New York?
part, I picked up a Brooklyn accent since I've been there. I'm originally North Jersey.
Okay. North Jersey, Brooklyn, they kind of go hand in hand, if you will. But we're so happy to have you here in Hampton Roads, Virginia. So tell us about internal medicine. I know a lot of times when I go to my doctor, he's a family medicine physician. But an internal medicine doctor, is that one and the same? Are they the same or different?
It's different in a way because we concentrate on it, first of all, on adults. We do not do pediatrics, but also we do not do psychiatry. We do not study about delivery of babies. And so basically we talk about and learn about the organ systems in the body and how they work, which appealed to me as an ex-engineer. And so we know in depth how the heart works, cardiology, how the lungs work, how the kidneys work, the problems with endocrine, diabetes, and other endocrine organ problems in the body, and neurology, for example. And so it was something I really enjoyed. It allows me to figure out what's wrong with people and to make them better. And being as an ex-engineer, I'm a problem solver. I enjoy meeting people, putting together their problems and solving them for them. Many times people have come to me and they say they've been to 4 to 5 doctors and I was the only one who could figure out what was wrong with them.
Well, that comes with experience. I mean, I think being in a field for 40 years and having that engineering background is definitely helpful. But from a medicinal standpoint, I believe you've seen a lot in the time that you've been serving patients throughout the community. So internal medicine, it's correlative to chronic disease management. Would that be fair to say?
There's a lot of chronic disease management, internal disease, whether it's chronic kidney disease, chronic heart disease, such as heart failure, angina, problems with the lungs, such as emphysema, strokes. And we do our best to alleviate the patient's problems and get them functioning as well as we can.
Awesome. Well, I can tell that we're going to definitely have to get you to come back and maybe even do a segment on each different chronic disease, because there's just not enough time in one show to cover them all. But let's talk about diabetes. So diabetes is very prevalent here in our community. But what I've noticed is that sometimes patients will say they didn't know that they were diabetic. They either didn't recognize the signs or symptoms. How does that work? I mean, are there any specific symptoms that they should be looking out for?
Well, yes, there are things that they can look out for. But to start with, often there's diabetes in the families. That's genetic, and that does play a large component. But if people want to escape the diabetes, they want to keep their waist. Men should have a waistline below 40 inches. Women should have a waistline below 35 inches.
Oh, God, I'm in trouble.
They should watch their diets. As I tell a lot of my patients, we can't eat like kids anymore. We have to watch our diet, which means a lot of veggies and protein. It takes the body a long time to break down protein, so it does solve a lot of hunger problems, and it will help the body by not raising the blood sugar, because the body cannot handle a high blood sugar. Too many foods today in the United States here are loaded with sugars. They do taste better, but you can't go by taste, and you really have to have an education to realize that you're damaging your bodies by eating too many sugary things, and we have to cut that down. Even more than the fats, the sugars are a very big problem.
Okay, so I wasn't prepared for the waist measurement piece, but I will address it. I've been trying to eat more veggies and more lean meats because my cholesterol and everything, and been trying to work on getting that down. So I do appreciate you for bringing that to our attention today. So let's talk a little bit about diabetes management, because it is very important. I know people think that once they receive a diagnosis of diabetes, they can just manage it on their own. Is that very likely, or does it normally require assistance from a provider such as yourself?
Well, most of the time, unfortunately, today the diabetes has gotten to the stage where we do have to put some medications in there. Patients will know that they have diabetes, sometimes even just from getting up at night to going to the bathroom a lot. The other thing they might do, I might add, is to get out and exercise, even if it's just walking every day. More vigorous exercise is even better, but at least walk and try to get some walking in, done every day, 15, 20 minutes, brisk rate. We do have some new medications out for diabetes, and they're very helpful, so we try to avoid insulin today as much as we can and try to keep things with the pill-type medications. The new type is medication that will cut down the desire to eat sweets. It also cuts down diabetic emptying from the stomach, so the stomach empties slower, and it gets more insulin out of the pancreas. And that's one type of new medication that we have that's very helpful to help people keep healthy. And the second one we have recently has come out is also medication that puts sugar in the urine. It has to be done carefully because people do get urinary tract infections, especially among the women. But it's something that can be helpful in getting the extra sugar out of the body and get the workload off the pancreas. the big things that people can do themselves, as I mentioned, is get your exercise, watch your diet. A lot of chicken, fish, and veggies is what I'm always telling patients. Try to avoid the bread, the rice, the potatoes, and anything with sugar, which so many foods have in this country that it's just depressing sometimes. And don't expect everything to taste good. You're here to keep yourself healthy and out of trouble. And without the good health, the diabetes can block up blood vessels and cause kidney failure and heart attacks and strokes. And these are things that we very much want to avoid in our patients here.
Absolutely. So let's say a patient believes that they may have symptoms of diabetes, or maybe they just want to be tested. Is there a testing that they can receive to tell them
Sure.
whether they are or
Yes,
not?
we have two good ways to check people. One is your immediate blood sugar, and of course that tells exactly where things stand right at this minute. And the other we have that came out about 1985 was called the glycohemoglobin, which is a measure of how much damage the sugar has done to the red blood cells. And this glycohemoglobin gives an average of about the last 3 months, because the blood lasts about 110 days in the circulation before it's recycled. And therefore, we know for about the last 3 months approximately where your blood sugars are. And this is very helpful as far as diagnosing diabetes and also in treatment.
Awesome. So for patients that are interested in scheduling an appointment with Dr. Rosenberg to get information, to maybe receive their wellness visit, they can call 757-393-6363. That's 757-393-6363. They may also visit the website at www.hrchc.org. Thank you so much for joining us, Dr. Rosenberg. We're going to have you back soon and very soon, okay?
Thank you very much for having me. It's been a pleasure.
Awesome. Well, thank you guys for tuning in. That's going to do it for this episode of We Care. Join us next week. We will be talking about Hampton Roads Healthcare for you.